Welcome back to Module 2, where we will look at two ways to begin instruction. I will share challenges I've encountered working with hospital homebound students and share intervention goals for pre-intentional communicators. Let's start with interventions. We are continuing to look at our pre-intentional communicator, oftentimes with severe physical or cognitive challenges. But with persistence and consistency, intentional communication can be developed. We have two ways to begin with our communicators. We can use their natural movements that they already have, or we can begin to teach switch skills. For our complex communicators, natural movements may be more intuitive than switch activation. If your team is thinking about switch activation, you'll need to consider the fine motor control needed. Does your student have the motor skills? But in the end, you're going to choose whichever method is easiest for the student. Before you begin, you need to consider the environment. Is the student at home? Is he in school? Is he residing in a facility like Sable Palms? Consider the family and caregivers. Will they be able to support the student learning a new skill? Also, is there a communication system already in place for you to begin with? You will need to assess the student's proficiency in communicating with the device. Let's look at typical scenarios for a hospital homebound student. Often, the family or caregiver already interprets the student's behaviors and have not sought out a communication system. Some parents have already provided a high-tech communication device, often an eye gaze device. Is this system working for the student? Does it have enough vocabulary? The concern with an eye gaze device is that many students obtain the device based on their ability to access it. That is, their ability to use their eyes to interact with the screen and play the eye gaze learning games. Many have not received training or therapy services aimed at teaching communication. Remember, you do not have to use the device if it is not effective for the student. You will need to open reeval and see what other system does work best in this environment. I've had the opportunity to support SLPs and teachers working with hospital homebound students, both here in Pinellas County and also in Broward County. I want to share some of the challenges I've encountered. I've seen teams using the setup pages instead of the communication software that comes with the device. Maybe they did not realize there was specific software. Instead, the private SLP or the IEP team created pages specifically for responding to academic questions, and many times they are yes/no pages. Oftentimes, the device is not secured on a mount to ensure that the eye tracker is picking up the student's eyes. Our students are in bed, they're in wheelchairs, or they're sitting on the floor or sofa. They're in a variety of settings without the device mounted, and so I've seen service providers hold the device in front of the student and even move it around to try and catch their eye gaze. But unless the eye tracker picks up the student's eyes, it is not useful. Often I find that the family doesn't use this high-tech device to communicate with their child. They already know what their child needs and wants. I've also come across private SLPs who are not familiar with teaching emergent communicators. They're doing a lot of yes/no and choice making. They set up several pages without knowing if the student is purposefully communicating a message with any of them. Many times the service providers are not sure if the student is responding purposefully, especially when the device is in the different positions. Sometimes the dwell time is set so low that any fleeting eye gaze on a symbol activates the message. it is hard to tell if that activation was purposeful or not. They also have pages where any choice is acceptable to the student. They have a page of all the students' favorite songs. Any button the student activates is fine with them. Was the student actually choosing a song? Was it a mishit due to the dwell time? Or did the student not actually make a conscious choice? Because of this, some students may need to start with just one message available to develop that intentional communication. Here is a flowchart that I developed to explain the two ways to develop communicative intent, whether the student's behaviors are reflexive or they have some intentional movement. You're always going to start with cause and effect. You can begin with natural movements or switch activation. If you begin with movements, students will learn cause and effect through interactions and routines, shaping these movements into intentional behaviors used to communicate. The student eventually learns to attach meaning to the movement. If you're starting with switch activation, students will learn cause and effect through switch play, using switches and switch-activated toys. Once they understand cause and effect, you can shape switch activation into intentional communication, starting with the word more. The student eventually learns to make a connection between the motor act of activating the switch to the response of getting more of something. Some complex students may need both interventions to develop communication. Either way, a student needs to develop intentional communication before they're introduced to a voice output device. Oftentimes, behavioral interventions, those using their movements, provide the foundation for learning and communicating, just like it does for infants when they put their arms up to be picked up. But then switch activation provides the tool to access a wider range of communication opportunities. As you work with your students, just keep in mind that the goal is for students to become independent communicators. The hope is that students will eventually learn switch scanning as a method to access vocabulary and communication. Several mid-tech devices like GoTalk32 Express can be accessed via switch scanning. Many communication apps and high-tech devices can also be accessed via switch scanning. Let's take a look at the intervention goal outlined in the book. You need to develop intentional communication via cause and effect. This is the end of Module 2. Next, you will complete a fill-in-the-blank activity in Nearpod.